Hi everyone, welcome to today's video where we'll learn about 10 common illnesses. We'll talk about how they work and how they affect your body. Just because we talk about an illness here doesn't mean you have it. If you don't feel well, the best thing to do is talk to a doctor or nurse. Stay informed, but don't worry, let's get started. First, let's talk about the flu. The flu, or influenza, is a common viral infection that affects millions of people every year. It can spread easily and cause a range of symptoms, from mild to severe. It seems to come around every year, especially when it's cold. This is because the flu virus thrives in cooler, drier climates, making it more prevalent during the winter months. The flu is caused by a tiny germ called a virus. This virus is highly contagious and can spread rapidly through communities, leading to widespread outbreaks. This virus likes to live in your nose, throat and lungs. Once it enters your body, it begins to multiply, causing inflammation and irritation in your respiratory system. It travels through the air when someone coughs, sneezes or talks. These actions release tiny droplets containing the virus into the air, which can then be inhaled by others. It's like a tiny cloud of germs. These droplets can linger in the air for a while, making it easy for the virus to spread in crowded or enclosed spaces. What does the flu feel like? The symptoms can vary, but they often come on suddenly and can be quite intense. A high fever, chills and a sore throat, a bad cough and body aches. These symptoms can make you feel very uncomfortable and can last for several days. For most healthy people, the flu goes away on its own. Your body's immune system works hard to fight off the virus. And with some rest and care, you'll start to feel better. Rest, drink lots of water and maybe have some soup. And you'll feel better in a week or two. Staying hydrated and nourished helps your body recover more quickly, but the flu can be serious for little kids, older people and people who are already sick. These groups are at higher risk for complications, which can sometimes be severe. So it's important to be careful and see a doctor if you're worried. Early treatment can help prevent complications and make a big difference in recovery. Getting a flu shot every year is a great way to stay healthy. The vaccine helps your body build immunity to the virus, reducing your chances of getting sick and spreading it to others. Okay, let's talk about another common illness, the common cold. It's something we've all experienced at some point in our lives. We all know that feeling, a scratchy throat, a stuffy nose, and a few sneezes. These symptoms can be quite bothersome and can disrupt our daily routines. Just like the flu, a virus causes colds, but it's a different virus. The common cold is usually caused by rhinoviruses, which are highly contagious and spread easily. It mostly stays in your nose and throat, which is why you get a stuffy nose, runny nose, sore throat, and maybe a cough. These symptoms are your body's way of fighting off the virus. Most people feel better in a week or two with tissues, cough drops, and some extra sleep. Rest is crucial as it helps your immune system combat the virus more effectively. The good news is, unlike the flu, there's no shot for a cold. This is because there are so many different viruses that can cause a cold, making it difficult to create a single vaccine. Your body is strong enough to fight it off. With proper care and rest, your immune system can handle the common cold without the need for medical intervention. Medicine from the store can help you feel better. Over-the-counter medications can alleviate symptoms, making it easier for you to go about your day. So, next time you feel a cold coming, don't worry. You'll be okay. Remember to rest, stay hydrated and take care of yourself. Your body knows what to do. Now let's talk about diabetes, a condition that affects millions of people around the world. Lots of people have diabetes, and it can affect anyone, regardless of age, race or gender. Diabetes is about how your body uses sugar, which is a crucial source of energy for your cells. Sugar, or glucose, comes from the food you eat and is essential for providing energy to your body. Your body needs something called insulin to use sugar properly. Insulin is a hormone made by the pancreas. Insulin acts like a key that lets sugar into your cells to give you energy. Without it, sugar can't enter the cells and stays in the blood. With diabetes, your body either doesn't make enough insulin or can't use it well, leading to high blood sugar levels. It's like having a key that doesn't fit the lock, making it difficult for sugar to enter your cells. So sugar stays in your blood, and that can cause various health problems over time, such as heart disease, nerve damage, and kidney issues. There are two main types of diabetes, type 1 and type 2. Each type has different causes and treatment methods. With type 1 diabetes, your immune system attacks the cells in your pancreas that make insulin, leading to little or no insulin production. Type 2 diabetes is more common and usually happens in grown-ups, although it is increasingly seen in younger people too. Being overweight, not exercising enough, and having a poor diet can increase the risk of developing type 2 diabetes. Making healthy lifestyle choices can help manage and prevent it. Okay, let's talk about high blood pressure. It's sometimes called the silent killer. High blood pressure is serious and can cause big problems if you don't take care of it. Blood pressure is how hard your blood pushes against the tubes in your body when your heart beats. High blood pressure makes your heart work too hard. Over time, this can hurt your heart, brain, and eyes. It can cause heart attacks, strokes, and other problems. That's why it's important to have your blood pressure checked. Let's talk about asthma. Asthma makes it hard to breathe sometimes. When you have asthma, the tubes that carry air in and out of your lungs get swollen and sensitive. Imagine something bothers your asthma, like dust or cold air. The tubes in your lungs get smaller and it's hard to breathe. The good news is asthma can be controlled. With the right treatment, most people with asthma can live normal lives. Let's talk about arthritis. Lots of people get arthritis, especially when they get older. Arthritis means your joints hurt. Joints are like hinges that connect your bones so you can move. But sometimes joints get worn out. There are many kinds of arthritis, but the two most common are osteoarthritis and rheumatoid arthritis. Osteoarthritis is like having worn out joints. Rheumatoid arthritis is when your body attacks its own joints. The most common symptom is joint pain. Sometimes joints swell up and get red too. Cancer. Understanding the basics. Cancer is a group of diseases where cells in your body grow too fast. Your body is made of tiny cells. Usually these cells grow in an organized way, but sometimes cells start to grow uncontrollably. These bad cells can form a lump called a tumor. Not all tumors are bad. Some are benign, meaning they're not cancer, but malignant tumors are cancerous and can spread to other parts of your body. There are many types of cancer named after the body part where they start. Alzheimer's disease, navigating the challenges. Alzheimer's is a disease that makes your brain shrink and forget things. It causes problems with memory, thinking, and how you act. Doctors don't know exactly what causes Alzheimer's, but they think it might be a mix of things. One sign is clumps of protein in the brain. Early signs of Alzheimer's include forgetting things. As it gets worse, memory gets worse, and it's harder to talk and solve problems. Depression. More than just feeling sad. Depression makes you feel very sad and lose interest in things. It's like a dark cloud that makes it hard to enjoy anything. The causes of depression are complicated, but many things can cause it. Symptoms include feeling sad, not enjoying things you used to like, changes in how much you eat or sleep, feeling tired, feeling bad about yourself, having trouble thinking and thinking about death. Depression can be treated with therapy and medicine. Therapy helps you think differently and learn how to cope. Medicine can help your brain feel better. COVID-19, staying informed and protected. COVID-19 is a sickness caused by a virus. It started in 2019 and spread all over the world. COVID-19 spreads easily from person to person, mainly when someone coughs, sneezes, or talks. COVID-19 can make people a little sick or very sick, and some people don't get sick at all. Symptoms include fever, cough, trouble breathing, feeling tired, body aches, headache, losing your sense of taste or smell, sore throat, runny nose, feeling sick to your stomach, and diarrhea. Getting vaccinated is a good way to protect yourself from getting very sick. Vaccines teach your body how to fight the virus. You can also wear a mask. Hi everyone, Dr. Mike here. Welcome to our health series where we explain common health problems in simple words. I really want health information to be easy for everyone to understand. And today we're talking about 3 problems that affect lots of people: diabetes, asthma, and anxiety. We'll look at what causes them, how to spot the signs, and most importantly, what you can do about them. Remember, knowing more is helpful, and understanding your health is the first step to a healthier you. So let's go. Let's talk about diabetes, a condition that affects how your body uses sugar, which is our body's main fuel. This condition is more common than you might think and can affect anyone, regardless of age or lifestyle. When you eat, your body breaks down food into sugar, called glucose, and puts it into your blood. This glucose is essential because it provides the energy needed for your cells to function properly. That's where insulin comes in. Insulin is like a key that unlocks your cells, so the sugar can go in and give you energy. Without insulin, your cells would be starved of energy, and you wouldn't be able to perform even the simplest tasks. It's made in your pancreas, a small organ located behind your stomach. The pancreas plays a crucial role in regulating your blood sugar levels. Now, with diabetes, there's a problem with this. Either your body doesn't make enough insulin, or it can't use the insulin it makes effectively. This leads to high levels of sugar in your blood, which can cause a range of health issues. There are two main types, type 1 and type 2. Each type has different causes and requires different treatments. In type 1 diabetes, your body mistakenly attacks the cells in your pancreas that make insulin. This autoimmune reaction means your body can't produce insulin at all. It's like the key maker is gone. Without insulin, sugar can't get into your cells, so your blood sugar gets high. This can lead to symptoms like extreme thirst, frequent urination, and unexplained weight loss. Type 1 usually starts when you're young and needs insulin shots for life. Managing this type of diabetes requires careful monitoring and regular insulin administration. Type 2 diabetes is a little different. It's more common and often develops in adults, although it's becoming more prevalent in younger people too. It often happens if you're overweight or don't move around much. Lifestyle factors like poor diet and lack of exercise play a significant role in the development of type 2 diabetes. Your body might not make enough insulin, or your cells might not listen to the insulin. This is known as insulin resistance, where the cells in your muscles, fat and liver don't respond well to insulin and can't easily take up glucose from your blood. It's like the key is there, but the lock is rusty. This means that even though insulin is present, it can't work properly to lower blood sugar levels. Type 2 usually starts when you're older, and you might be able to manage it with healthy eating and exercise, but sometimes you need medicine, including insulin. Lifestyle changes can be very effective in managing type 2 diabetes. So how do you know if you might have diabetes? Recognizing the symptoms early can make a big difference in managing the condition. Some signs are peeing a lot, being really thirsty, losing weight without trying, always being hungry, feeling tired, blurry eyesight, and frequent infections, and cuts that take a long time to heal. These symptoms can be subtle at first but should not be ignored. These can be signs of other problems too, so don't try to figure it out yourself. It's important to consult a healthcare professional for an accurate diagnosis. If you have any of these, see your doctor for tests. Blood tests can confirm whether you have diabetes and help determine the best course of action. Finding and treating diabetes early is really important to avoid other problems. Early detection can prevent complications and improve your quality of life. Diabetes can cause serious problems like heart trouble, which can lead to heart attacks and other cardiovascular issues, strokes, kidney problems, nerve problems, and trouble seeing. These complications can be severe and life-threatening if not managed properly. The good news is that with the right treatment, like medicine, checking your blood sugar, and regular monitoring, you can keep your diabetes under control. Healthy food and exercise are also crucial components of managing diabetes effectively. A balanced diet and regular physical activity can help maintain healthy blood sugar levels. You can live a long and healthy life with diabetes. With the right approach, you can lead a fulfilling life and minimize the impact of diabetes on your daily activities. Now let's talk about asthma, a common yet often misunderstood condition that affects millions of people worldwide. Asthma makes it hard to breathe because the tubes that carry air in and out of your lungs, known as airways, get swollen and smaller. This inflammation and narrowing of the airways can make breathing a real challenge. Imagine trying to breathe through a straw. That's what it can feel like for someone with asthma during an attack. The airflow is restricted, making each breath a struggle. Lots of things can trigger asthma, like things you're allergic to, things that irritate your lungs, colds, exercise, or even stress. These triggers can vary from person to person, making asthma a highly individualized condition. Things you might be allergic to include dust mites, pollen, pet hair, and mold. These allergens can cause your immune system to overreact, leading to an asthma attack. Irritants can be things like smoke, air pollution, strong smells, and cold air. These environmental factors can inflame your airways, making it difficult to breathe. When these things trigger your asthma, the muscles around your airways squeeze tight and the airways swell up and make extra mucus. This combination of muscle tightening, swelling, and mucus production severely restricts airflow. This makes it hard to breathe, and that leads to asthma symptoms. These symptoms can range from mild to severe and can vary in frequency and intensity. The most common symptoms are wheezing, which is that whistling sound you hear when you breathe. This sound is caused by the air trying to move through the narrowed airways. Coughing, especially at night or early in the morning, is another common symptom. This persistent cough can be bothersome and can disrupt your sleep. Shortness of breath or feeling like you can't get enough air is also a frequent symptom. This can be particularly alarming and can make everyday activities challenging. And chest tightness, which feels like something is squeezing your chest, is another common symptom. This can be quite uncomfortable and can make it hard to take deep breaths. If you think you or someone you know might have asthma, it's important to see a doctor. Early diagnosis and treatment can help manage the condition effectively. They'll probably do tests like spirometry, which measures how much air you can breathe in and out. This test helps determine the severity of your asthma and guides the treatment plan. Asthma can be mild or serious, and the treatment depends on how bad it is. Your doctor will tailor the treatment to your specific needs, which may include medications and lifestyle changes. Your doctor might give you medicine, like inhalers with steroids to reduce swelling or inhalers to open up the airways, or both. These medications are crucial in managing asthma and preventing attacks. They'll also help you figure out what triggers your asthma and make a plan to manage it. This plan will include strategies to avoid triggers and steps to take if you have an asthma attack. With the right treatment, most people with asthma can live normal, active lives. Managing asthma effectively allows you to participate in activities you enjoy and maintain a good quality of life. Let's talk about anxiety disorders. These are conditions that affect millions of people around the world, and they can be incredibly challenging to deal with. These are the most common mental health problems affecting people of all ages, backgrounds, and walks of life. It's important to understand that anxiety disorders are not just about feeling nervous or worried occasionally. Anxiety disorders make you worry and feel afraid a lot, and it can make everyday life hard. Everyone feels anxious sometimes, like before a big test or a job interview. It's normal and helps us deal with stress. This kind of anxiety can actually be beneficial as it prepares us to face challenges, but when anxiety is really strong, happens all the time, and starts to run your life, it might be an anxiety disorder. This kind of anxiety can interfere with your daily activities, making it hard to work, study, or even enjoy time with friends and family. There are different kinds of anxiety disorders, each with its own unique set of symptoms and challenges. Generalized anxiety disorder, or JD, makes you worry a lot about different things like work, health, money, or relationships for at least 6 months. This constant worry can be exhausting and overwhelming. People with JD often feel restless, on edge, tired, have trouble focusing, have tense muscles, and can't sleep well. These symptoms can make it difficult to function in everyday life. Panic disorder causes sudden, unexpected panic attacks. These attacks can be terrifying and may happen without any obvious trigger. These are sudden bursts of intense fear that happen quickly. They can make you feel like you're losing control or even having a heart attack. During a panic attack, your heart might race, you might sweat, shake, feel short of breath, have chest pain, feel dizzy or sick, and feel like something terrible is about to happen. These physical symptoms can be very distressing. Social anxiety disorder makes you really scared of social situations. This fear can be so intense that it interferes with your ability to interact with others. You might be afraid of being judged or embarrassed. This fear can make it hard to speak up in class, go to parties, or even eat in front of other people. People with social anxiety might avoid social situations completely or feel really uncomfortable in them. This avoidance can lead to isolation and loneliness. If you think you might have an anxiety disorder, talk to a mental health professional. They can help you understand what you're experiencing and provide support. They can tell you for sure and suggest the best treatment, like therapy, medicine, or both. Getting the right treatment can make a big difference in managing your anxiety. Cognitive behavioral therapy, or CBT, is a type of therapy that's especially helpful for anxiety. It focuses on changing the negative thought patterns that contribute to anxiety. It helps you change negative thoughts and behaviors that make you anxious. By learning new ways to think and act, you can reduce your anxiety and improve your quality of life. Medicine can also help manage anxiety symptoms. There are different types of medications that can be effective, and your doctor can help you find the right one. Remember, you don't have to suffer alone. There are many resources and support systems available to help you. With the right help and treatment, you can manage your anxiety and live a good life. It's possible to find relief and regain control over your life. Thanks for watching. Remember, always talk to a doctor or other health professional if you're worried about your health. Don't try to treat yourself. It can be risky. It's important to get the right diagnosis and treatment plan. Stay informed, stay healthy, and don't hesitate to ask a health professional if you have any questions. Take care. Knowing stuff is helpful, especially for your health. We're going to chat about 3 different health problems: TB, pneumonia, and depression. Don't worry, we'll keep it simple. The more you know, the better you can look after yourself and your family. Knowing things is the first step to feeling good about your health. Now let's get started. Tuberculosis, or TB, is a serious infectious disease that primarily affects your lungs. It is caused by a bacterium called Mycobacterium tuberculosis. When someone with active TB in their lungs coughs, sneezes, speaks, or even sings, they release tiny droplets containing the bacteria into the air. These droplets can linger in the air for several hours, especially in enclosed spaces. When another person breathes in these contaminated air particles, they can become infected with TB. This is why TB is highly contagious and can spread quickly in crowded places. Tiny bits with the germ can float in the air, and you can breathe them in without even realizing it. Once inhaled, the bacteria can settle in your lungs and begin to multiply. From there, they can spread to other parts of your body through your bloodstream. The most common signs of TB are a persistent cough that won't go away, sometimes accompanied by blood in the sputum. Other symptoms include a high fever, unexplained weight loss, and night sweats. These symptoms can be mild for many months, which can delay diagnosis and treatment. Remember, not every cough is TB. Coughs can be caused by a variety of factors, including common colds, flu, or allergies. However, it is important to be vigilant and aware of the symptoms of TB, especially if you have been in contact with someone who has the disease. Lots of things cause coughs, like colds or allergies. These are usually short-lived and go away on their own. But TB-related coughs are persistent and can last for weeks or even months. If you notice that your cough is not improving, it is crucial to seek medical advice. But if your cough hangs around for weeks, see your doctor. Early detection of TB can make a significant difference in the effectiveness of treatment. Your doctor can perform various tests to determine if you have TB. They can do tests like a skin test or a chest X-ray to see if it's TB. The skin test involves injecting a small amount of testing fluid into the skin of your forearm and checking for a reaction after a few days. A chest X-ray can reveal changes in your lungs that are indicative of TB. Finding TB early is really important for treating it. Early treatment can prevent the disease from spreading to others and reduce the risk of complications. TB is treatable with a course of antibiotics, but it requires a long-term commitment to medication, often lasting 6 months or more. Adhering to the treatment plan is crucial for a full recovery and to prevent the development of drug-resistant TB. Pneumonia is when the air sacs in your lungs get infected and swollen. These sacs can fill with fluid, making you cough, have phlegm, get a fever, and have trouble breathing. Different germs like bacteria, viruses, and fungi can cause pneumonia. Common signs are a cough, maybe with phlegm, fever, chills, shortness of breath, and chest pain when you take a deep breath. Like TB, not every cough or fever is pneumonia, but if you're struggling to breathe or your symptoms are bad or don't go away, see your doctor quickly. They can figure out if it's pneumonia with a checkup, a chest X-ray, or other tests and tell you what to do. Depression is more than just feeling sad. It's a complex mental health condition that affects millions of people worldwide. While everyone experiences sadness or low moods from time to time, depression is a persistent feeling of sadness and loss of interest that can interfere with your daily life. It's a serious illness that changes how you feel, think, and do everyday things. It can affect your ability to work, study, eat, sleep, and enjoy life. The symptoms of depression can vary from person to person, but they often include feelings of hopelessness, fatigue, and a lack of interest in activities that were once enjoyable. It's not a weakness, and it can happen to anyone. Depression doesn't discriminate. It can affect people of any age, gender, or background. It's important to understand that having depression doesn't mean you're weak or that there's something wrong with you. It's a medical condition that requires attention and care. Everyone feels sad sometimes, but depression is different. It's a persistent feeling that doesn't go away on its own. It's not something you can just snap out of. Depression can make it difficult to function in your daily life and can lead to a range of emotional and physical problems. It's feeling sad, hopeless, or empty for more than 2 weeks. These feelings can be overwhelming and can make it hard to see any positives in life. You might feel like there's no way out, but it's important to remember that help is available. It can also make you lose interest in things you used to like, such as hobbies, social activities, and even spending time with loved ones. This loss of interest can further isolate you and make the depression feel even more intense. Change how much you eat or sleep, make you tired, and disrupt your daily routine. You might find yourself sleeping too much or too little, and your appetite might change, leading to weight loss or gain. These physical symptoms can add to the emotional burden of depression. Make it hard to focus, concentrate, or make decisions. This can affect your performance at work or school and can make everyday tasks feel like monumental challenges. You might find it difficult to remember things or to stay organized and make you think about death or suicide. These thoughts can be frightening and overwhelming, but it's crucial to reach out for help if you're experiencing them. Talking to a mental health professional can provide you with the support and resources you need to manage these feelings. It's normal to feel down sometimes. Life has good and bad bits, but when these feelings persist and start to interfere with your ability to live your life, it's time to take action. Depression is treatable, and with the right support, you can start to feel better. But if these feelings stick around and make it hard to live your life, get help. There are many effective treatments for depression, including therapy, medication, and lifestyle changes. A mental health professional can work with you to develop a treatment plan that's right for you. It's okay to ask for help. It's a good thing, and it's how you start to feel better. Reaching out for support is a sign of strength, not weakness. Whether it's talking to a friend, family member, or healthcare provider, taking that first step can make a big difference in your journey to recovery. If you think you might have TB, pneumonia, or depression, the first thing to do is talk to a doctor. Don't wait if you have symptoms that worry you. Finding and treating these problems early is really important. Your doctor is there to help, to listen, figure out what's wrong, and help you get better. Don't try to figure it out or treat it yourself. Reading helpful information is good, but it's not the same as seeing a doctor. If your doctor thinks you might have TB, they might do a skin test or a blood test. These tests look for the TB germ in your body. If the tests are positive, a chest X-ray can show how bad the infection is. The good news is TB can be treated with antibiotics. Take the medicine exactly how your doctor tells you, even if you feel better before you finish all of it. This stops the germ from becoming resistant to the antibiotics. Finishing all your medicine is important for you to get better and to stop TB from spreading to other people. If your doctor thinks you have pneumonia, they'll listen to your lungs and check for a fever. This is often the first step in diagnosing pneumonia, as these symptoms can indicate an infection in the lungs. The doctor will use a stethoscope to listen for any abnormal sounds in your lungs, such as crackling or bubbling, which can be signs of pneumonia. They will also check your temperature to see if you have a fever, which is a common symptom of pneumonia. In addition to a physical exam, your doctor might do a chest X-ray. The X-ray can show if your lungs are inflamed or have fluid in them, which are key indicators of pneumonia. The X-ray images help the doctor see the extent of the infection and determine the best course of treatment. Sometimes the X-ray can also help identify other conditions that might be causing your symptoms, such as a lung abscess or other lung diseases. They might also do a blood test or a sputum sample depending on what they think is causing your pneumonia. Blood tests can show if your body is fighting an infection and can help identify the type of bacteria or virus causing the pneumonia. A sputum sample, which is a sample of the mucus you cough up, can also be tested to find out what kind of germ is causing the infection. This information is crucial for determining the most effective treatment. Treatment depends on what caused it and how bad it is. Your doctor will consider several factors, including your age, overall health, and the severity of your symptoms. They will also take into account whether the pneumonia is caused by bacteria, viruses, or fungi, as this will influence the type of treatment you receive. In some cases, hospitalization might be necessary, especially if the pneumonia is severe or if you have other health conditions that complicate your recovery. Bacterial pneumonia is usually treated with antibiotics. These medications can effectively kill the bacteria causing the infection and help you recover more quickly. It's important to take the full course of antibiotics as prescribed by your doctor, even if you start to feel better before finishing the medication. Stopping antibiotics early can lead to a recurrence of the infection and contribute to antibiotic resistance. Viral pneumonia often gets better with rest, fluids, and medicine you can buy at the chemist. Over-the-counter medications can help relieve symptoms such as fever, cough, and body aches. Rest is crucial because it allows your body to fight off the infection. Drinking plenty of fluids helps keep you hydrated and can thin the mucus in your lungs, making it easier to cough up. Sometimes, antiviral medications might be needed. These are prescribed if your pneumonia is caused by a virus that can be treated with antiviral drugs. Your doctor will decide if this is necessary based on the type of virus and the severity of your symptoms. Antiviral medications can help reduce the duration and severity of the illness, but they are not effective against bacterial pneumonia. It's important to rest and drink lots of fluids if you have pneumonia. Rest helps your body recover, and staying hydrated is essential for maintaining your overall health. Drinking fluids can also help loosen mucus in your lungs, making it easier to expel. Your doctor might also recommend other supportive treatments, such as using a humidifier to keep the air moist or taking pain relievers to reduce discomfort. Your doctor will tell you what to do and when you should feel better. They will provide specific instructions on how to manage your symptoms and what signs to watch for that might indicate your condition is worsening. Follow-up appointments might be necessary to monitor your progress and ensure that the treatment is working. Recovery times can vary, but with proper care, most people start to feel better within a few days to a week. If you think you might have depression, talk to a doctor or a mental health professional. They can tell you for sure and help you find the right treatment. Treatment often involves therapy, medicine, or both. Therapy gives you ways to cope and helps you understand and manage your feelings. Medicines like antidepressants can help balance chemicals in your brain that affect your mood. Finding the right treatment can take time, so talk to your doctor about what works best for you. Knowing things is helpful for your health. We've talked about TB, pneumonia, and depression, 3 different health problems with different symptoms and treatments. Remember, finding these problems early and getting professional help is really important. Don't be afraid to talk to your doctor if you're worried about your health. They're there to help you get better and give you the right treatment and support. Your health is really important. Understanding your body and asking for help when you need it are important for living a long and happy life. Let's talk about hypertension, which is another name for high blood pressure. It's a condition that affects millions of people around the world, often without them even knowing it. Hypertension is a major risk factor for heart disease, stroke, and other serious health problems. Understanding what it is and how it affects your body is crucial for maintaining good health. Imagine your arteries are like roads and your blood is like cars driving on them. When everything is running smoothly, the cars move along without any issues. But what happens when there's a traffic jam? The cars get stuck and the roads become congested. This is similar to what happens in your arteries when you have high blood pressure. High blood pressure is like having a traffic jam on those roads all the time. The constant pressure can damage the walls of your arteries, making them less flexible and more prone to blockages. Over time, this can lead to serious health issues, including heart attacks, strokes, and kidney problems. This puts a lot of stress on your heart and blood vessels, making it more likely to have serious problems like heart attacks and strokes. Your heart has to work harder to pump blood through the narrowed arteries, which can lead to heart failure if left untreated. It's like asking your heart to run a marathon every day without any rest. The tricky thing about high blood pressure is that it often has no clear signs. You might not feel any different even though your body is under significant stress. This is why hypertension is often called the silent killer. It can quietly damage your body for years before you even realize there's a problem. That's why it's called the silent killer. Regular checkups are essential because they can detect high blood pressure early, allowing you to take steps to manage it before it leads to more serious health issues. Early detection is key to preventing long-term damage. You might feel perfectly fine, but inside your arteries are working too hard. This constant strain can cause tiny tears in the artery walls, which can then become sites for plaque buildup. Over time, this can lead to atherosclerosis, a condition where the arteries become hardened and narrowed. Now, I know what you might be thinking. Dr. Mike, I'm stressed all the time. Does that mean I have high blood pressure? It's a common concern, but it's important to understand the difference between temporary stress and chronic hypertension. Not always. Stress can make your blood pressure go up for a little while, but it doesn't mean you have high blood pressure all the time. Temporary spikes in blood pressure due to stress are normal, but if your blood pressure remains high even when you're relaxed, that's when it becomes a concern. The only way to know is to have it checked. Regular monitoring can help you and your doctor understand your blood pressure patterns and determine if you need treatment. Home blood pressure monitors can be a useful tool for keeping track of your readings between doctor's visits. That's why it's so important to see your doctor regularly and have your blood pressure measured. Your doctor can provide guidance on how to manage your blood pressure and reduce your risk of complications. It's a simple step that can make a big difference in your overall health. It's like checking the oil in your car. A simple check can prevent big problems later. Just as you wouldn't ignore the maintenance of your car, you shouldn't ignore the maintenance of your body. Regular checkups can catch potential issues early and keep you running smoothly. If your blood pressure is high, don't worry. There are many effective ways to manage it. Your doctor can help you develop a plan that includes lifestyle changes and, if necessary, medication. The goal is to keep your blood pressure within a healthy range to reduce your risk of complications. There are things you can do. Eating a balanced diet rich in fruits, vegetables, whole grains, and lean proteins can help lower your blood pressure. Regular physical activity is also important. Aim for at least 30 minutes of moderate exercise most days of the week. Your doctor might suggest changes like eating healthy foods, exercising regularly, and managing stress. Stress management techniques such as meditation, deep breathing exercises, and yoga can be very effective in lowering blood pressure. Finding healthy ways to cope with stress is crucial for maintaining good heart health. Sometimes they might also give you medicine to help lower your blood pressure. There are many different types of blood pressure medications, and your doctor will work with you to find the one that's best for you. Medication can be an important part of your treatment plan, especially if lifestyle changes alone aren't enough. The important thing is that high blood pressure can be managed, but you have to take care of your health. By making healthy choices and following your doctor's advice, you can keep your blood pressure under control and reduce your risk of serious health problems. Get your blood pressure checked, talk to your doctor, and take steps to keep those arteries healthy. Remember, managing your blood pressure is a lifelong commitment, but it's one that can lead to a healthier, longer life. Don't wait until it's too late. Take action now to protect your heart and your health. Next, let's talk about eczema, a condition that goes far beyond just having dry skin. We all get dry skin sometimes, right? It can happen due to cold weather, hot showers, or even just not drinking enough water. But what if your dry skin doesn't go away, no matter what you do? But eczema is different. It's a long-term skin problem that makes your skin red, itchy, and very dry. Unlike occasional dryness, eczema can be persistent and often requires more than just a good moisturizer to manage. Imagine your skin has a protective wall that keeps moisture in and bad stuff out. This wall, known as the skin barrier, is crucial for maintaining healthy skin. With eczema, that wall is weak, making your skin sensitive. This means that irritants and allergens can easily penetrate your skin, causing inflammation and discomfort. What makes this wall weak? Well, it can be a few things. Sometimes it's just the way your skin is naturally built. Your genes can play a part, meaning if someone in your family has eczema, you might get it too. This genetic predisposition can make your skin more prone to developing eczema. Things around you can also cause it, like things you are allergic to, things that irritate your skin, stress, and even changes in the weather. For example, pollen, dust mites, and pet dander are common allergens that can trigger eczema flare-ups. Remember, not all dry or itchy skin is eczema. Sometimes it's just a temporary reaction to environmental factors. Sometimes it's just your skin reacting to dry air, strong soaps, or even new laundry detergent. These can strip your skin of its natural oils, leading to dryness and irritation. So how can you tell the difference? It's important to pay attention to the symptoms and how long they last. Eczema usually causes itching that doesn't go away, redness and sore skin, often in places like the bends of your elbows or knees. These areas are particularly prone to eczema because they are frequently flexed and can become irritated easily. If you have skin problems that don't go away, don't just think it's dry skin. Persistent symptoms are a key indicator that you might be dealing with something more serious. See a skin doctor or a doctor. They can provide a proper diagnosis and recommend a treatment plan tailored to your specific needs. They can tell you if it's eczema and what to do about it. A professional diagnosis is crucial for effective treatment and management. Treating eczema usually means doing a few things like using gentle soaps and moisturizers, avoiding things that make it worse, and sometimes using special creams or medicine to help the soreness. It's about creating a skincare routine that supports your skin's health. The important thing is to find what works best for you and your skin. Everyone's skin is different, so it may take some time to discover the right combination of treatments and products. Finally, let's talk about migraines. Migraines are not just simple headaches. They're a complex neurological condition that affects millions of people worldwide. Understanding migraines can help in managing them better. We've all had headaches, right? Those annoying pains that come and go, often relieved by a quick nap or an over-the-counter painkiller. But a migraine is much worse. It's a debilitating condition that can significantly impact your quality of life. It's not just a headache, it's a problem with your brain that can cause really bad pain, often on one side of your head. This pain can be so intense that it interferes with daily activities. Imagine your brain is having a little electrical storm, and the pain signals are going crazy. This storm can last for hours or even days, making it hard to function normally. Along with the throbbing pain, migraines can also make you feel sick, make you throw up, and cause severe nausea that can be just as debilitating as the headache itself. They can make you sensitive to light and sound, turning everyday environments into unbearable places. Migraines can even make you see flashing lights or zigzags known as auras, which can be very disorienting and frightening. Not every headache is a migraine. Factors like not drinking enough water, stress, and lack of sleep can all cause normal headaches. These types of headaches are usually less severe and can often be managed with lifestyle changes and over-the-counter medications. But if your headaches are very bad, happen often, and stop you from doing everyday things, it might be more than just a regular headache. When headaches become so severe that they interfere with your ability to work, socialize, or even perform basic tasks, it's crucial to seek medical advice. It's important to see a doctor. A healthcare professional can help determine if what you're experiencing is a migraine and guide you on the best course of action. They can tell you if it's a migraine and what to do. Proper diagnosis is the first step towards effective treatment. Treating migraines often means doing two things. First, figuring out what causes your migraines and avoiding them. This can involve identifying specific triggers that set off your migraines. This might mean writing down when you get migraines to see if certain foods, stress, or even changes in the weather cause them. Keeping a headache diary can be very helpful in pinpointing these triggers. By documenting your migraines, you can start to see patterns and identify what might be causing them. This information is invaluable for both you and your doctor. Whether it's certain foods, high stress levels, or even weather changes, knowing your triggers can help you avoid them and reduce the frequency of your migraines. Second, finding ways to stop the pain when you have a migraine. This might involve a combination of medications and lifestyle changes. This might mean taking over-the-counter pain medicine, medicine from your doctor, or even other therapies like acupuncture or biofeedback. Alternative therapies can also be effective. Techniques like acupuncture, biofeedback, and relaxation exercises can provide relief for some people. The important thing is that migraines can be managed, but it takes planning and talking to your doctor. A comprehensive approach often yields the best results. Don't just deal with the pain. Get the help you need to feel better. Your doctor can work with you to develop a treatment plan tailored to your specific needs. Living with migraines can be challenging, but you don't have to do it alone. There are many resources and treatments available to help you manage your condition. Get the help you need to feel better. With the right approach, you can reduce the frequency and severity of your migraines and improve your quality of life. Thanks for watching. We talked about some important health topics today, but remember, don't try to figure out what's wrong yourself. If you're worried about something, talk to a doctor or nurse. They can give you the right answers and help you stay healthy. Stay curious, stay informed, and don't worry. Knowing more is helpful, and understanding your body is the first step to a healthier life. See you in the next video, and remember to like, comment, and subscribe.